Hi friends, today I will talk about a simple assessment tool, that is Alvarado score, for diagnosing acute appendicitis. First is the disclaimer. Caring Docs YouTube channel does not provide medical advice. Information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only, and it should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention and treatment of medical illnesses. There is no endorsement for any brand or a company. Friends, this Alvarado score is a clinical assessment tool which helps in predicting the acute appendicitis. Here we use physical sign, symptoms and certain lab tests in diagnosing acute appendicitis. Because of this clinical assessment tool, we can avoid unnecessary investigation and CT scan. So it is very useful for ruling out appendicitis, especially when the score is less than 3 or 4, as its sensitivity is 96% at that time. It also helps in identifying high risk patients who will require hospital admission and further surgical intervention if their score is more than 6 or 7 or more. And then the sensitivity of this test increases to 58 to 80%. The various uh, assessments which we do in this test can be remembered as MANTRELS as a mnemonic. In MANTRELS, M stands for migration of the pain to the right iliac fossa, A stands for anorexia, N is nausea and vomiting, T is tenderness in the right iliac fossa, R is the rebound tenderness or other indirect signs of pain, E is the elevated temperature, L is leukocytosis, and S is shift of the leukocytosis to the left. In this, M is migration of the pain to the right iliac fossa. It is given as a 0.1. A is anorexia, and we also do urine dipstick for ketones. If it is more than 2, we give it a point of 1. Nausea and vomiting is given a score of 1. Tenderness in the right iliac fossa is given 2 score. Rebound pain or indirect sign like Rovsing, Dunphy, Markle and percussion tenderness, they are given 1 point. Elevated temperature or fever is given 1 point. Leukocytosis is given 2 point. When shift of leukocytosis to the left, that is neutrophilia, is given 0.1. Total score is 10. And if the score is less than 5, appendicitis is unlikely. If the score is 5 to 6, it is compatible with acute appendicitis. If the score is 7 to 8, we give it suggests probable appendicitis, and if the score is between 9 and 10, it is very high probability of appendicitis. Importance of the Alvarado score is it gives acute diagnosis. It helps identifying acute appendicitis with high sensitivity of 96% and high specificity. It minimizes unnecessary imaging and also reduces the radiation exposure and healthcare cost. The early intervention enables prompt surgical consultation and treatment, so reducing the complication and mortality. It helps in streamlining the triage, effectively stratifies the patient for hospital admission and surgical referral. Helps in clinical decision supports, provides a simple and evidence-based tool for medical officers to make informed decision. It improves the patient outcomes, enhance timely and appropriate management of the acute appendicitis, leading to better patient outcome. So in the last, this summary highlights the significance of Alvarado score in improving diagnostic accuracy, reducing the unnecessary test and enabling the early intervention, ultimately leading to a better patient outcome. Louis Pasteur has said, science knows no country because knowledge belongs to humanity, and it is the torch which illuminates the world. With this, I conclude my today's topic. Thank you. Keep learning.